Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the use of antibiotics versus herbs for the treatment of tick-borne illness. So lots of my patients ask me this question: do antibiotics work better than herbs? And the answer is not necessarily, but they work faster. So if you're looking to get well quickly, the fastest way to get well is to use antibiotics, but not everybody wants to do that. So everybody, has the right to choose their own healing path, and lots of patients just choose herbs. I think that the key to using herbs is that you have to use several, like 3 or 4, and depending on what infections you have, there's herbs that are really good at hitting Lyme. There's herbs that are really good at hitting Bartonella. It just depends. Artemisinin is very good for Babesia. And, it just depends on what infections you have and how long you've had them. The longer you've had the infections, the deeper the organisms are in your tissues and the harder it is to get at them. Because over the years, the organisms build up biofilms, and those biofilms protect the microorganisms in such a way that it's more difficult to actually kill them when they're in the biofilm. So, I do not think that antibiotics are the end-all be-all, but I do think that if you want to get well quickly, antibiotics are the way to go. Now, if you are a poor detoxifier, antibiotics are going to kill more quickly, and so your detox pathways are going to get clogged more quickly. And so, for sure, you should be doing all the detox things: saunas, lemon water, warm lemon water, Benadryl, Epsom salt baths, milk thistle, you name it. You really need to keep those detox pathways open, because the killing that comes from antibiotics is quite a bit more than in herbs. The other thing is that almost all of the herbs are made with alcohol. And so for people who can't tolerate alcohol, it's not a good idea. So also people who are on drugs who you can't use alcohol with them, like Flagyl, Tindamax, and many other drugs. You cannot even take alcohol in a tincture. It can cause liver damage, and it can put you in the ER. So when people ask me what should I do, well, it's an individual choice. Most of my patients choose to do both herbs and antibiotics, because that seems to work the best. And that's what I do, and that's what I suggest to my patients. But really, people have to choose their own path, and I generally will follow whatever the patient wants to do. So that's my best answer for you, and I hope you have a wonderful day, and take care.